Welcome back. And now we're turning our eyes to the Nigerian health sector. We see that the health sector faces a lot of challenges, and this leads most of the citizens to, travel abroad in search of proper medical care. And this affects a lot of things in our health system. So we're going to be discussing Nigerian health sector in the eyes of the world with Nick Agule, global economic analyst, joining us via Zoom this morning. Good morning.
Good morning to you, and good morning to our viewers globally.
Good morning. Now, first of all, let's look at the passing of our former president Buhari. How did you take the news of his passing? How did that, how did you feel upon hearing of his death?
And like every other death, when it happens, there is sadness. So I felt sad. Actually, I didn't expect it. It was shocking because even before he left office, he started to look very well. And even after he left office, he continued to look well. He came into the public eye when he relocated from his base in Daura to Kaduna. That gave us the opportunity to see him once again after he left office, and he wasn't looking sickly. So later it was said that he has gone to London for medical checkup, which again, I took it that is the usual medical trips he was making. So when the news came last Sunday that he had died, it was shocking. And the sad reality of all humanity that every one of us who is alive now, breathing in and out, we are going to take a last breath one day. What we don't know is when, where, and how.
All right, and there has been, a lot of reactions following this sad news. Some from, the citizens of Nigeria. A lot of people have their opinions and their reactions about him and his death. So, what about you? What do you think about these reactions?
Well, every soul, when they pass, people discuss their deeds or misdeeds whilst they were alive. Like I wrote on my social media page, we are still discussing Adam and Eve, the first humans. We still talk about them from time to time. People make reference to them depending on the context of the discussion. So it is the fact of life that anybody that dies, people are going to have one thing or the other to say about them. Some will be positive and some will inevitably be negative because, like I wrote on my social media handle, even Jesus Christ, as we speak today, we're still discussing his death and his life and times on earth. And some of the discussions are negative. Majority are positive, but some are still negative. There are people today who have negative things to say about Jesus Christ. So this is the reality of life, and it only teaches us, those of us who are alive, that in carrying on our activities whilst we're alive, let's not just be looking at the moment. We also have to be looking at the fact that one day we will not be here again. And if we're not here again, what will people be saying about us? What legacy are we going to leave behind? A majority of people going to be saying positive things about us in terms of how we changed their lives and how we made life easier for them and every other thing we did in our transactions with them, or they'll be saying things negative based on how we conducted ourselves, as if we're emperors, as if we're immortal, as if nobody could do anything to us. So when death finally does something to us, is bound to draw out emotions from people in terms of how they feel about you. As we speak today, we are still discussing Adolf Hitler. We are still discussing Idi Amin. Their matters are written, their life histories are written in books. We are also discussing Mandela, Nelson Mandela, Martin Luther King Jr., Lee Kuan Yew. We are discussing them, and there is a way the world discusses them. But what is a very difficult job that people try to do is to revise history. So you come up today now, as they are discussing Hitler, you try to make Hitler look like a saint. And if you see people who are actually saying Hitler was a murderer and he engaged in a mass genocide and all of that, and then you are angry, oh, why are you speaking like that about Hitler? He's already dead. Don't speak of the evil of the dead. Don't be mocking the dead and all that. I tell such people that you have a very difficult job because you cannot stop history of people who have lived through this life to be written or spoken about or discussed even in generations to come. So I think it's in our hands to know that when we eventually pass away from this world, our deeds and misdeeds will be discussed.
All right, now let's come down to the Nigerian health sector. First of all, how would you describe the current state of healthcare in Nigeria?
There's no healthcare in Nigeria as we speak today, and I know exactly what I'm talking about. It's not as if there are no healthcare facilities in Nigeria. There are, some of them are of standard, especially the private sector ones. They are of standard. You can obtain medical care in Nigeria, maybe that is of quality, like you could probably get somewhere else in the world. But there is no nation in the world that I know of that leaves healthcare to the person who can afford it. Nigeria is the only country today that I have traveled to, and I've been to many countries where the government has left healthcare to the affordability of the citizens. What governments do elsewhere is that there are two social services. They don't just completely leave to people's ability to pay for them, and that is healthcare and education. And that is because of the nature of these two services. These two services are human services. They are related to life, because somebody who is not educated, honestly, doesn't have life, is going to end up being a burden on society. And then somebody who is not healthy, his productivity now collapses. He is dehumanized, and possibly he dies even before he starts to make an impact in this life. So, given these two major human needs, governments elsewhere don't allow healthcare to be on the basis of pay for it, or go without it. And in Nigeria, that is exactly what is happening now. When I was growing up in Nigeria, we had government hospitals. Those hospitals, at least if you are sick, you go to a government hospital, they treat you for free. I was growing up in Boko in Benue State. We had a general hospital. When you visit the general hospital, right from the point of registration to the point of consultation, test, and the medication, maybe injection or even admission, surgery, we didn't pay kobo because that was government actually offering health care to citizens. Those who could afford private care could go and afford private care. And 1983, when I think it was this Sani Abacha who was announcing the coup that overthrew President Shagari, he said, "Oh, that our government hospitals are now mere consulting clinics." And I think no, that was a coup that actually installed by IBB, if I think very well. And you ask yourself that today, as we speak, the government hospitals are not even those consulting clinics again. Because if you are sick now and you approach a government hospital, they are going to bill you. And if they bill you and you are not able to pay, they will not attend to you. So you can just imagine that millions of Nigerians, perhaps more than 100 million Nigerians with these healthcare services. So it's a global example in ignominy that we have set that citizens can just become ill and then they cannot afford healthcare and they are left on their own and some of them just die. And that is just one aspect of healthcare because healthcare is in two parts. Healthcare is in a preventative and then it's in curative. So I just spoke about the curative, which is the hospital care. How about preventative? How much are we doing to prevent people from getting sick? You know, Nigeria does not even have the data of people who are suffering any specific type of illnesses. You know, because that is the kind of data that governments elsewhere use to redirect research into certain areas. So if government elsewhere notice that, oh, people are actually getting sick with diabetes, too much diabetes, they will focus more research to prevent diabetes, and then they will now engage in public healthcare services to ensure that people, take the necessary steps, lifestyle changes, and the kind of food they eat and all of that, so that they don't become diabetic. Because it is easier, cheaper, and better for you to prevent people from getting sick than allowing them to get sick and then start spending money to heal themselves. And none of these services is happening in Nigeria. And people who can afford healthcare can afford it. Those who can't, they are left to their own devices, which is quite sad.
All right, now speaking on the affordability, now it seems like there are two different narratives because when you meet medical personnel who work in the public health sector, they tell you that it's relatively cheap because it's a government hospital, it's a public hospital, it's cheaper, and they have more professionals that would attend to all kinds of illnesses as opposed to the private sector. But when you meet the citizens, they tell you that the prices are so expensive and they can't afford it. And when you get to the hospital, there is no one to attend to you. So it's quite difficult. How do you reconcile these two narratives?
Well, sometimes it's better for people to even travel and go to other places so that they can see how things are happening there. Because for me, it's very surprising to hear that a healthcare service provider in Nigeria say that hospital care in public hospitals in Nigeria is cheap. I have had to deal with many instances where people go to public hospitals and maybe they need to have surgery. And this person wants to have surgery, and they are billing them 1 million, 2 million, 3 million, 4 million, 5 million, depending on what that is. In a country where minimum wage is 70,000 and unemployment rate is so high, a healthcare service provider will say, oh, that's cheap. I don't understand what they mean by affordability. You know, such people need to travel to a place like the United Kingdom. The United Kingdom, by all standards, is a developed nation. And the United Kingdom has free comprehensive healthcare at all levels. Primary level is the one you call the family doctor. So everybody is registered to a family doctor. The family doctors are not in the hospitals. Their practice are actually within the community. So every community, you won't go more than a kilometer, you will see a primary health. I mean, you will see what they call general practitioners. You will see a GP, and then so if you are ill, you go to your GP. Your GP has all your records, and they will look at what you are complaining about. And if it is something they can deal with it, they can deal with it. If there is something they cannot deal with it, they now refer you to a hospital. So hospital now becomes secondary healthcare. You don't just walk into a hospital, your GP must refer you there. So you go to hospital, and hospital will look at what you are complaining about. They run tests, do every sort of things for you, X-ray, all that. And then if it's something they can treat, they can treat you. If they want to put you on admission, they can put you on admission. But if they now notice that it is something that requires specialist care, they now refer you to a specialist hospital, which is tertiary healthcare. Say, for instance, you go and they now say, oh, the problem is a cancer. So they will now refer you to a cancer hospital. When you go to that cancer hospital, the only thing they deal with there is cancer. From the receptionist to the most senior doctor in that hospital are all cancer specialists. So that is the way healthcare is happening in the United Kingdom. And ask me, how much is it that the citizens are paying? The answer is zero. It is totally free. And so if you look at unemployment rate in the United Kingdom, it's less than 5%. That means 95% of people who can work are in jobs. The pay is appreciably higher, right? A minimum wage is like £3,000, which in Nigeria, if you convert that in naira, is 6 million naira, minimum wage. And yet healthcare is zero, free. So a healthcare professional in Nigeria who looks at the high unemployment rate in Nigeria, the low incomes in Nigeria, and still say that government hospitals are demanding money from patients is still affordable. First and foremost, why are they not even asking themselves that both the federal government and the state government, they make budget for these hospitals. So they are collecting budget from the government to run healthcare, and at the same time, they are charging the patients. What is happening to all that money? In fact, whoever that says that, I don't reckon what they are saying at all.
All right, now looking at the deplorable state of our healthcare system, how would you say that this affects our economy? What economic problems arise from having a weak healthcare system?
Big problems. Because one of the factors of production is labor. Yeah, one of the factors of production is labor. People who read basic economics, we know that. So if you now have a labor force that is not healthy, that is always down, that means your productivity is not going to be optimal. Not only that, you have a cost of treating people. So families now, instead of them to look for food to buy and eat, they are taking the money to go and buy drugs and do others, leaving the family hungry, empty, without the ability to solve their other problems. And then when this thing eventually results in a death, it psychologically affects the family members, friends, and those who knew of this disease. So there are a lot of people who are going through trauma, especially like there are some where the death happens such that the person couldn't afford healthcare at all, just lay down there in the house and die in the house with the family members helplessly begging but not seeing any support. For such people, they live through such trauma, psychologically damaged, the emotional health becomes an issue. And one of the problems is because we don't even have food in Nigeria. There's no adequate food in Nigeria. And the body needs food. The first medicine the body needs, as he said, is food. And Nigeria, there's a lot of hunger everywhere. Even children growing up, they are not seeing adequate food. And when you don't have enough food in your system, your body can't build enough immunity that will withstand any sickness that comes. Any sickness that hits you will just walk through an open door and start to disturb your life. So there's a lot that is happening, and that is why, like I said before, elsewhere the governments invest a lot in preventative healthcare so that people don't get sick. That way, government doesn't now need to be using money that they could have put in other sectors to now be putting it in healthcare so that they will try and keep people alive. Nigeria really needs to pick up. We are so backward. We are not ready. We are not ready. And it's not only healthcare. It's in all sectors. As we speak today, electricity is 5,000 megawatts. So a lot of people don't have it. Education is decayed. The roads are bad. No water. Insecurity now. People don't even have security, which is something that government should be providing. You can't go to farm and do farming there. Even those who can go to farm, they don't have machines. So they are farming with their brute physical energy, which doesn't produce much. There's so much that these people in leadership position at the federal, state, and local government should be doing. Unfortunately, they are not doing it. And if they are not doing it, there can be no magic that will make Nigeria to start growing, developing, and become like other nations, unfortunately.
All right. Now, we also see that a lot of private establishments, now hospitals, are springing up, due to the inadequacy of the public hospitals. So, do you think that the private hospitals can do better with the health system? Do you think it will help improve Nigeria's healthcare system?
Certainly, of course, like you rightly said, because the government hospitals have been allowed to decay, that the private sector is trying to fill the gap, trying to fill the void that has been created. But, like I said, no nation in the world, no developed nation, a nation that knows its onions, throws all the citizens under the boss of the private sector, because the private sector, in as much as they are into a humanitarian service of providing healthcare, they are businesses. They want to make profits. So for them, they offer their services to people who can pay for them, right? And so there is private healthcare everywhere. There is private healthcare everywhere. Even in the United Kingdom, there are private hospitals. But those private hospitals are there for those who can afford them. The vast majority of the people are going through the current National Health Service, the NHS, which is free for everybody. Whether you are poor, you are rich, or whatever your background, it's free for everybody. And that is where Nigeria should also be. Even though the private sector are coming in to fill the gaps, government now needs to provide health care that every other person can go to. You don't have to be rich. You don't have to be able to afford private sector health care before you'll be able to be taken care of when you are sick. But then there's something I want to advise all our viewers. Um, they say that when you are in a kind of situation, you have to be trying your best to see what you are going to do to get out of it. We have what we call health insurance. So health insurance requires you to be paying a specific amount of money every month, just like you pay insurance on your vehicle. So you'll be paying a specific amount of money every month. If you are not sick all through the year, no problem. Your money will be used in healing other people who are sick. So you are like in a pool. You are bringing your money together. And if you are sick, then that health insurance will not take care of you. That way, it is better and more assured that you have healthcare available to you than waiting until you are sick and then you start begging. And if people can't offer you support, then you sometimes die miserably without any, healthcare, available to you. So people should consider this health insurance thing. If you want to know more about it, you can always just ask for health insurance schemes around where you are. There are a lot of them.
Okay.
They call them health management organization, HMOs. You always find them. They say you are like in a village or somewhere, but even at that, if you come to town, to a city near you, town, you can access them and then you can cover that will work for you. That way you are paying regularly, small sums, instead of waiting to be billed 1 million naira by a government hospital and you are unable to pay. Even though I spoke about the health insurance, that does not absolve government of their responsibility to provide health care, because the duty of government is to provide welfare and security. And so government at all levels, federal, state, and local government must understand that Nigerians cannot be thrown under the bus without health care. Thank you.
Thank you very much.
Save Nature TV. News in your pocket.